The pelvic girdle is the beginning of the appendicular skeleton for everything that is below our belt. The pelvis is composed of hip bones, which are called the os coxae. So for singular, it would be called the os coxa, as well as the sacrum and the coccyx. However, the sacrum and the coccyx both are part of the vertebral column, which is the axial skeleton. So when we consider the lower limb, we begin with the pelvic girdle. And the pelvic girdle consists of these hip bones, which are a fusion of three different bones. So if we zoom in here a little bit, we can actually see those three bones. So commonly it would be called the hip bone. The most superficial and largest bone is the ilium. On the ilium, we have some important structures to know, like the iliac crest is the highest part of the ilium, as well as a couple spines. If we follow from the iliac crest forward in an anterior direction, where it forms a spine is the anterior superior iliac spine, which is sometimes abbreviated as ASIS. Following backwards from the iliac crest, we have the posterior superior iliac spine, sometimes abbreviated as the PSIS. Then there's another spine which is below the ASIS called the AIIS, the anterior inferior iliac spine. The second major bone that makes up the hip bone is the ilium, and the third bone is the pubis. All three of these bones meet at an important structure called the acetabulum. That's very important because that's where the head of the femur articulates with the hip bone. The joint where the two pubic bones meet is called the pubic symphysis. And then there is an important foramen in this region called the obturator foramen. You can also see the sacrum and the coccyx on this diagram, but again, those are only part of the axial skeleton. So the hip bone is referred to the os coxae. There's fusion of the ilium, ischium, and pubis between 13 and 15 years of age. The important articulations that occur are anteriorly with the other hip bone, posteriorly with the sacrum, that's at the sacroiliac joint, abbreviated as SI joint, and laterally with the femur at the acetabulum. So all three bones of the hip contribute to the acetabulum. It's a deep socket, kind of like the glenoid cavity was, but deeper. And in this case, for the head of the femur. So let's look at the largest bone in the hip first. The ilium is the largest of the three fused hip bones. It makes up the superior portion of the hip bone. And the features that I've highlighted for you are the iliac crest. So when you put your hands on your hip, you're putting them on your iliac crest. If we feel from the iliac crest forward and backward, you can feel those superior and inferior spines, projections from the iliac crest. Then inferior to the ilium is a bone called the ischium. And the features of the ischium, the main one is the ischial tuberosity, and it supports the weight of our body when we're sitting. So when you are seated, it's actually your ischial tuberosity that's touching the seat. So looking at a lateral view of this bone here, we can see the ilium on the top, the posterior superior iliac spine, or the PSIS, anterior iliac spine, or the ASIS, the ASIS, and the PSIS in the back. We can see on the ischium, the ischial tuberosity, So again, when we're sitting, the ischial tuberosity is what's touching the seat. The acetabulum is where all three bones meet. It's almost like they meet generally like this. So we would see the ilium region here, the ischium here, and the pubis here. The pointed part of the pubic bone is the pubic crest, and there's an important hole for a large nerve that goes through called the obturator nerve. That's called the obturator foramen. For the lower limb, it has a total of 30 bones. The femur is in the femoral region, which is the thigh. The patella is the kneecap in the patellar region. Then in the lower leg, we have the tibia and the fibula in the crural region. 7 tarsals in the ankle. So remember, for the upper limb, we had 8 carpals instead of the 7 tarsals that we have. So the tarsals would be in the proximal foot. There's 5 metatarsals in the arch of the foot and 14 phalanges in the toes, just like in the hands. In the hands, remember, there were also 14 phalanges. Our femur is the longest, strongest, and heaviest bone that's actually in the body. The head of it articulates with the os coxa at the acetabulum. There's a greater trochanter and a lesser trochanter. Remember, in the humerus, there was a greater tubercle and a lesser tubercle. In the femur, these are attachment sites for powerful hip and thigh muscles. At the knee joint, there are condyles, the medial and lateral condyle. So recall that in the humerus, they have specific names of capitulum and trochlea. Here we just call them condyles. So a medial condyle and a lateral condyle. Then there's epicondyles, which are projections just superior to the condyles. And then finally a patellar surface where it articulates with the patella. Looking at our image of the femur here, we can see the head of the femur shown first, that which is going to articulate in the acetabulum. The greater trochanter is going to be more proximal than the lesser trochanter. The gluteal tuberosity is where the gluteus maximus muscle is attached. Looking at the distal end of the femur, we can see the medial condyles, the lateral condyles, and then the epicondyles, which are just above the condyles. The next bone in the lower limb is the patella, the kneecap, which is within the tendon of the quadriceps femoris muscle. And because of that, that's why we call it a sesamoid bone. Its articular surface articulates with the patellar surface of the femur.